So we're now going to start an English discussion forum on COVID. Today we are privileged to have three inviting guests. One is Professor Ivan Hong from internal medicine professor in internal medicine of Lee Ka-shing Medical School in Hong Kong U, and also chief in the infectious disease. And the second is Dr. Andrew Wong, and he is the president of Hong Kong Infectious Disease Society. And then we have Dr. Emily Hong, and Emily is the specialist in pediatrics. Welcome you all. And so we just have the announcement of the Great China submitting the first case to WHO of noticing the first case of coronavirus, the new coronavirus, in the New Year's Eve of 2020. And then 3 weeks after, we start to have our first case in Hong Kong. And this is the start of our lullaby in the time of corona, not cholera. So Ivan, how is the situation now in Hong Kong?
Well, I think in Hong Kong we are pretty much in control. We have just more than 60 confirmed cases, and so far we have up till now 2 mortality, which in fact one of the mortality may not be related at all to the infection. The other one is an elderly gentleman with very bad comorbidity, and we know that this is a high-risk group for the coronavirus infection. In general, most of our cases are relatively benign, that they do have pneumonia, but it's a relatively stable cause, and in fact many of them responded to the treatment very well, and many of them I think will be discharged very soon. In terms of the high risk, we know that for people who are elderly with past medical history, especially those with chronic lung, chronic heart disease, tends to do worse. And that many of them do have more severe pneumonia compared to the younger age group. So this is the scenario that is unfolding. Nevertheless, I think we do see a lot of, we suspect that there are many carriers or asymptomatic carriers in the community that is not, have not presented to the hospital. And that they will be, as I said, transmitting the virus within the community.
Yeah, we're going to talk about the silent spreaders in a minute. So, Ivan, we have just touched on the new coronavirus right after the first case was diagnosed, remember? And we talk about the progress of the typical patient, take the reference from SARS. And then you mentioned the first week probably is the most roller coaster course, and then if the patient can survive the first week, probably the outlook will be pretty much better. So judging from the sample that we see in Hong Kong, is that still hold true for the new coronavirus?
Well, I think the novel coronavirus is slightly different from the SARS coronavirus, even though it's 80% similar in terms of the genomic sequencing. The SARS is much more severe, especially if during the second week of the infection, that there's a lot of complication in terms of severe pneumonia, a lot of cytokine storm, hence a lot of mortality, especially in the second week. Comparing with that, the novel coronavirus is sort of in between SARS and influenza. So it is relatively, compared to SARS, is much milder. Nevertheless, compared to influenza, the mortality rate is higher. So SARS is around 10%. The novel coronavirus, we're talking about 2% or probably going to be lower. And influenza around 0.1%. So basically, it's sort of in between. The problem with this virus is that it's very contagious. It is very, can easily be transmitted among the community due to the asymptomatic carriers reason. The other problem, of course, is that this virus tends to, again, that the viral load tends to peak as will be seen by one of the publication by Professor Molly-Pierres later on today in New England Journal of Medicine, is that the virus tends to peak within the 48 hours from symptom onset. So it's different again from SARS, because SARS, we know that the viral load actually peak in the second week. So this is actually peaking at 48 hours. So from symptom onset. So again, as I said, if you can treat the patient earlier in the first week, then usually the course will be much more stable, and that the patient hopefully will not develop complication in the second week.
Yeah, and that actually leads my questions on the treatments nowadays. Remember last time we talked about the treatment. So the mainstay of treatment during the SARS period that you shared last time is mainly the supportive. And perhaps with the introduction of the antivirals, the protease inhibitors and so on. So how is the situation today for the new COVID?
Yes, we are currently using Kaletra as a mainstay of treatment or the standard of care for our patients, which they seems to be doing pretty well on that. We also be trying say like a triple combination using Kaletra, interferon, and also with ribavirin. And it looks as if these patients tend to respond a little bit quicker. But again, we have very limited patients enrolled in the study. So we need more data before we can confirm the results on these patients. So nevertheless, even with single therapy, with the Kaletra, the patient seems to be doing pretty well. This is probably in contrast to the findings in China, where they are saying that by using Kaletra, it doesn't seem to work very well in the patient. I think the reason for that is because for the Chinese cohort, I think that they have been, many of them are so-called late presenters, that they're presenting probably well in the second week of their infection, and hence they are already pretty far down their disease. So as a result, using the antiviral treatment may not be very effective if it's already in the second week. And already the lungs are very consolidated, and it's very difficult for the drug to work.
Right. And we have two largest cohort released from Great China, and one is by Professor Zhong Nanshan, around 1,000 cases in different provinces. And then the other biggest cohort, around 70,000 cases, just released yesterday. So I would like to ask you for some quick comments on that. Now, first of all, in Professor Zhong's cohort, actually the median onset time is around 3 days. And that actually makes sense when you talk about the peak of the viral load is about 48 hours. Is that correct?
Yes, correct. But the important finding, I think, from the Professor Zhong Nanshan's cohort is that the incubation period can be very long. It can be up to 24 days in his cohort, and that in terms of the median, it could be a little bit shorter. But I think it's the very long incubation period time that poses a big problem for this virus, and that makes it very contagious.
All right. So and the other thing is that in Professor Zhong's cohort, actually only 1% of those people contracted the wildlife and then leading to the disease. And does that surprise you?
No, because this is the 1% is that it's the origin of the entire epidemic. So I'm not too surprised on that. And because at the beginning, even though it's just 1%, the transmission could be, very quick, especially you don't know what you're dealing with at the beginning. So I'm not surprised with that.
is it right to say that actually the majority of the cases presenting later on during the epidemic will be from the human-to-human transmission?
Yes, it's very likely that because of the change in the spike protein, which allows which is different from SARS, and that allowing the virus to be attaching to the human mucosa much easier, and hence it's much more contagious. So that's why it's man-to-man transmission is the key to the transmission of the spread of this virus. And initial studies said the R naught is 2.7, which I think if you review the data now, I think it's much higher than that, and that is it can be spread to much more. One person could spread probably to like 4 or 5 individuals rather than just 2.8 at initially what we estimated. So it's definitely very contagious and could spread in the community very easy.
Okay. So now, thank you for your comments, Ivan. Now we come to the silent spreaders, and that is focused on the second largest cohort, the 70,000 patients identified in China. And during that cohort, actually, one thing that really alarms me is that there was more than 800 cases which are asymptomatic. I think we are getting worried because actually we see a lot of these generations of new cases with an identifiable source. And how do you define these asymptomatic case or silent spreaders in the current epidemic?
Well, I think it's probably 800 is a bit underestimated.
All right.
In terms of number of asymptomatic carriers. I think it's many more than that. As I've said, the problem is that this virus has a very prolonged incubation period. And that, if you say like take 14 days is the median for the incubation period from one or from a few of the studies. We presume that within that 14 days, probably for the first 4 or 5 days after you have been infected, there is a so-called window period when you actually has been infected, but you are not shedding the virus. And then for the next 9 or 10 days, then you still remain asymptomatic, but you are start to shed the virus, okay, from maybe from your respiratory mucosa, or maybe from even in the GI tract from your stools. So that is a big problem because then these asymptomatic carrier basically will be walking around in the community if they are not wearing masks, or especially during mealtime. Have you seen many of the outbreaks in the local outbreaks? Is that when they take off the mask, then they will be the droplets will be there are actually viruses in the droplets, and this could be very, very infectious.
All right, thank you. So in summary, Ivan, I would like you to, since all of us has experienced the first SARS and now we come to experience the COVID. So compare with SARS, actually, how do you say the current situation or our health measures in controlling the epidemic?
Well, I think overall, I think the health measure has been that the government and CHP and the HA is doing is very effective in that we are containing the virus in terms of confirmed cases to around 60, which is even better than Singapore and Japan such. So I think we're doing a pretty good job in that sense. But the important thing, of course, we have to be aware of is that this virus behaves very different from SARS. And as I've said, it is much less lethal than SARS, but it's very contagious, and almost as contagious as influenza. So the outlook or what we are seeing is perhaps this virus is going to stay with us forever. Very similar to that of other much more benign coronavirus like OC43, 229E, or HKU1. So and it's more and more becoming like a influenza-like virus.
All right.
Although with a slightly more higher risk of developing pneumonia and complications compared to influenza.
Yeah.
But we have to see what's going to happen.
Yeah.
And again, the highest risk group are those elderly, male patients, and those with comorbidity. So this is very, very similar to influenza.
All right.
So again, I think the way to perhaps prevent this from our population from getting the virus is to have a vaccine to deal with this at the end of the day.
Yeah. Any hope in the near future? Any hope? Any hope for the near future?
I think quite a number of institutes are doing the vaccine, including HKU, and I think finger crossed we will have the vaccine. If they're able to expedite it, the process, we may have it in like 3 or 4 years, or even earlier. But again, we have to wait for the phase 1 study results before we have we can give you more details on it.
Now, despite the fact that Ivan shared with us the fantastic job by the team of the clinicians under Ivan's team, and also in the other hospitals, because of the ample experience in managing the SARS, I think the clinicians are doing fantastic jobs. Now, my question, perhaps the other panel can share as well, is a little bit controversial, is the border control. Now, we have the first case around 3 weeks after the first announcement, submission to the WHO from the Great China. And then we just have some travel warning. And then the border control is not strictly shut down or quarantined, maybe 10 days after the first case, or at the same day, or more or less at the same day of the first mortality in Hong Kong. So would that also make an impact on our epidemic in Hong Kong? Anyone? Ivan, what's your view?
Sorry, Casey, you mean the border control?
Yes. So if we can, so it's a hindsight, Ivan. So if
it's difficult to comment. Obviously, if you're able to close the border entirely, when the Chinese government closed the Wuhan city, when we close our border at the same time, then perhaps you can delay the epidemic in Hong Kong. But the problem, as I've said, is that this virus is in fact very, very contagious, and is more and more likely. It is like it's like a 風土病. It's like a seasonal thing.
Yeah.
So it's likely that even though we close the border at that time, we can't close it forever. So at the end of the day, if like we wait for like 2 or 3 months. But then the virus is still going to come when you open the border again, because and it's high risk because none of our citizens will have immunity, and so we are basically delaying the epidemic, but not actually stopping it. If you look at it in hindsight, So I don't know. It just, I think in a way maybe it is fortunate that we didn't actually close the border entirely. We actually close it partially as such, and we are not letting too many infected individuals to come into the city, and that we are letting it like a small number of infected individual, and hence we there is a local outbreak, but the local outbreak is not very severe, so-called in a controlled fashion. So that people are now they will probably eventually will a large population will eventually contract the virus, but because of in a controlled fashion, that the infected individual will have an early diagnosis and get treated much earlier, and also that people are starting to develop a so-called antibody response or immunity to this virus in the community. It's gradually building up. So it might be by chance that this is turned out to be a not too bad scenario.
Right.
After all.
Yeah.
If you look at this in hindsight.
Yeah.
So in a much more controlled fashion, that gradually people are getting infected and developing immunity. But again, we have to see what is going to turn out. And also that very fortunate is that we do have antiviral for this treatment, for treatment for this virus, for this infection, and also that in general outside Hubei, most of the cases are relatively mild. So this is a so-called maybe a blessing in disguise.
Yeah, we are going to wait to see how the border control or the total shutdown of the human traffics can really have impound a great public health measures. Basically, this is not something that easy to be said than done. Any other comments from the panel?
Well, I think the major issue for the border control is actually nowadays we might have to rethink whether there is a possibility to be extended to other countries. For example, Japan is really one of the countries that we really have to rethink now, because you can see that the third generations of spreading is going on rampantly and without much knowledge of us knowing how it is being spread, just like in the case of the Diamond Princess as well. Yeah. So passengers from Japan or travelers from outside mainland China are now, as a government, I think and the people of Hong Kong as a resident here, I really would think that travelers from outside the world, other places, high-risk areas like Japan, do we need to impose a 14 days of quarantine now to people coming from Japan now? Is it really a concern for me now after listening to both Dr. Hao and Professor Hong here?
Yeah. Andrew, any comments from you?
Yes, of course, theoretically, that would be good to ban all the countries where there's a outbreak. But I think people will be selective. And then so yesterday I heard from the news that there are only 3,000 visitors to Hong Kong. So we will not have a lot of people coming to Hong Kong during this period of time anyway. And that I think that we have to think about the strategy of which countries is high risk and which was as the outbreak evolve around the world, and that it's become more global and it's more difficult to delineate the borders.
Now, I think it's rightly that Emily bring out the burning issues now Hong Kong people are hearing every day, and this is about the Diamond Princess. And that is the sad lullaby of love in the time of cholera. But we are living in the age of the time of the corona. So actually, we have 3 major cruise ships and actually create an epidemic disaster. And one is contained in Hong Kong, the World Dream cruise, and then the Wonderland cruise, which released in Cambodia after rejected by 6 countries. And then during the time that the passengers released from the ship, and then they are so happy in Cambodia, and actually they embrace and shake hands and they smile with as if they're leaving the hell. And then we thought that's the end of the story, but that's not true, because on the way, one American lady, when she landed in KL, Kuala Lumpur, actually she was identified as a case. And that kind of the train of infection is really horrifying. And then the more burning issue is the Diamond Princess, now has been stationed in Yokohama since the early of February. And then we are sending 60-man team try to rescue and repatriate all the Hong Kong citizens, around 300 something. And then up to today, the figure of infection has doubled since we last time talked with you, Emily. It's around 53, which is really a roller coaster kind of the data. So, Emily, you have just talked with one of our DJ, Sammy Leung, Sunmei, and actually his parents are actually in the on the deck. So, can you share share with us?
Right. So 2 days ago, when we have this webcast, we talked with Sammy Leung, Sunmei, and actually I've been in contact with him on and off. And the most important thing is that his parents are very keen to come back to Hong Kong with the government's chartered flights. So to set the record straight, his parents are very grateful to the government's help. Indeed, there are about 300, almost 350, 330 Hong Kong passengers on board. And there are a reported 53 being confirmed to be positive now. And as of just now, before we have this webcast, we have reports saying that almost like 200 something people from Hong Kong will come back, hopefully, with the government's chartered flights. But there are certainly some, which are the reason why we're here, do not want to come back or maybe want to stay in Japan because they are tested negative. So this is the main issue today. If they are tested negative, what should they do? And those who are negative, when they come back to Hong Kong, how should we quarantine them? And is there any way we can follow up and make sure that before they become symptomatic, we can do something better or earlier for them?
Now, we don't have too much details of the whole event in the Diamond Princess. So, Ivan, just what we hear just now from Emily or from the news, as an expert in infectious disease, how do you feel about this epidemic origin, these epicenters in multiple cruise ships?
Well, I think it's definitely very reasonable for the government to receive or to receive these 200 odd passengers back, Hong Kong citizens back to Hong Kong. Nevertheless, the most important thing is to how we can actually quarantine these 200 odd passengers who are asymptomatic and tested negative, because we expect that a proportion of them will eventually become confirmed or infected, or maybe they have already been infected, but just as I said, during the incubation period they are not sharing the virus, hence they are not tested negative. So the plan, of course, is to quarantine these 200 odd passengers, return passengers in the estate in Fortan, which I think is a very reasonable thing for the government to do. And I think that, of course, that these 200 odd passengers, they will need to be tested regularly, not just temperature measurement. Perhaps they will need to be tested for, whether they are developing both symptoms and becoming, carriers of this virus. So they will be needed. They will probably need to be tested at the baseline, and then regularly, probably every 7 days until they finish the 14 days quarantine. So, which I guess the CHP will be doing that.
Right.
And then once they are confirmed, then they can be quickly transferred to the hospital to get isolated and get treated straight away. So I think that is the best way to proceed.
Yeah. And concerning the quarantine for these incoming 300 or minus the detained, confirmed cases. So what will be the possible best public health measures?
I think as far as quarantine is concerned, I think it's important that these so-called high-risk individuals be quarantined in facilities which is a single room and with ensuite toilet, so that they won't be mixing of people between these people who come back, and they will be under strict surveillance. And so I'm quite confident because in Hong Kong we have ample experience of dealing with the isolation and quarantine during, for example, swine flu period. And so these people, when they come back, and then I think with sufficient quarantine period, and then we will monitor them and then serially, and then they will be safe to go back to the community.
Okay. Now back to Emily. When you talked to Sammy, did you identify any loopholes? Why the Diamond Princess cruise ship becomes such a big epicenter with such a high speed of transmission?
It is really unknown because according to Sammy's description, that they seem to be taking every step they can to prevent the outbreak. First of all, according to the CNN and also the website from the Princess Diamond cruise itself, that they have involved WHO and also CDC in creating the guidelines for preventing transmission. So a few days after they have docked the ship in Yokohama, they have already started to change some practices, including changing, first of all, initially they send food directly to the room service. Later to change the utensils and also the serving, they serve the food in individual disposable boxes. And the crew members who went to serve the food are dressed with masks and also gloves. And they have minimal contact with the crew. And they were given a lot of equipments, including hand wash, hand rub, face mask, and even Valentine gifts to ease their mood. But they were given some cleansing materials and substance that they can clean their own room. So it seems that the people in the passengers seems to be well taken care of. But the crew members, according to the information that we obtained from CNN and also from other websites, have different stories. So the main problem maybe from my reading, is that the crew members, they still have to work together. They have to stay within the rooms shared by other co-workers. And the crew members, even some individuals who identify themselves on the news, stated that even if they have symptoms for 2 days, that they have a delay of checking of the infection and the rapid test because probably of the lacking of materials.
Now, but despite the fact that you mentioned about the good things and the courtesies and ethics and done in the cruise ships on Sammy's parents, I think we still see more than double of the new cases identified. So may I ask the panels, based on the existing information, so what are the possible public health loopholes that create such a drastic epicenter?
Well, let me start. So there are a few things we are currently thinking. First of all is the air conditioning. Yeah. Secondly, it will be the sewage system. And then thirdly, it could be the human factors because up to now, as I've chatted with Dr. Wong just now, there is no current reports on how many crew members are actually affected. How are they screening? If they have given any priorities to the crew members for screening for this COVID-19 first. So as far as we know from the air conditioning, first of all, that they have been getting fresh air, 100% fresh air, without recycling, according to the news report. As for the sewage system, we have no idea. But we know that they have been given some cleansing material so that the passengers can clean themselves using those provided equipments and also provided cleansing solutions to clean their own bedroom. And as for human, then it will be the next problem.
Yeah. So what are the quick comments, Ivan?
Well, I think the whole thing, I think it's a wrong decision from the Japanese government to basically quarantine all these passengers in the ship in the first place, because it's a very confined environment, and also, you know, you're sharing the air conditioning system, you're sharing the toilet may be linked together, and also, as said already, that the crew members has maybe one of the first one to be infected. So yes, they're actually the carriers who are passing the virus to the entire ship. So in hindsight, of course, you know, the best way to do this is to, in fact, quarantine the passengers in a camp or stadium. You let them on board, and then you do a baseline, quick test on these patients. If they are confirmed positive, then they got isolated in the hospital and get treatment. If they are symptomatic and the test is negative, then they should also be isolated in hospital. But once they become positive, they should get treatment straight away. And for those who are negative and asymptomatic, they should be, quarantined in a stadium or other facilities. And that probably was the best way to deal with this kind of situation, because then you can actually separate those infected with the uninfected right from the beginning, rather than caging them in the ship and letting the virus to spread. Which now it's already too late, because a lot of people have been infected, and the requirement for isolation and treatment is much larger now. So this probably was the wrong decision in the first place, I think, from the Japanese government.
Yeah. And then the other concern is that when these passengers has been sent back to Hong Kong, and what will be the possible public health measures to contain these big numbers of clients? Andrew?
Okay. I think it's very important these so-called high-risk people be quarantined properly, and meaning that they have to be in under close surveillance, and they were not allowed to go into the community, and during that quarantine period, and then for the proper quarantine, the requirement would be they have to be in a single room with the ensuite toilet, and with all the infection control practices in order, so they would not transmit the virus to other people.
So, Ivan, would you agree that actually we start to count in 14 days after they land in Hong Kong, or right after they check negative?
Yes. So once they land in Hong Kong, then they should be quarantined straight away in the estate in Fortan, and of course the baseline, rapid test should be done as a baseline screening. And then perhaps then, they should be monitored very closely, and then they could be, in a way they could be tested again regularly, and if they become positive, then they should be isolated and get treatment straight away. That probably would be the best way. And once the 14 days quarantine period is finished, then they can be allowed to be discharged.
Now, the other concern is that actually we are sending 60-man team as a repatriating team to try to facilitate the return of these passengers. And these 60-man team, majority are just general government officials, and maybe a minority of them are actually the health-related personnel. And not any one of these, I suppose, not from the dirty teams from your side, Ivan. So would that also be a risk, because they are rushing to a great epicenter ever?
I don't think it's a risk. I think they have made preparation, and I think the officials will be primed, and that they will probably not be coming into close contact with these passengers, apart from the healthcare workers looking after them. And the healthcare workers, of course, will be fully geared, and so I don't think that will be a problem to cause cross infection with the flights. Yeah.
And in terms of facilities, maybe Ivan, Andrew, or Emily, you can comment. Are we ready in terms of the facilities and support to quarantine or support the treatment of these possible, somebody named more than 100 cases coming in Hong Kong? So are we ready for that, Ivan?
Well, I think they are. They actually did a pretty good job and quickly renovate the estate to facilitate this quarantine facilities. So I think they did a pretty good job on that. And I think all the basic daily support and everything is ready. So so I don't think there will be a problem in terms of quarantine these passengers. I think they are very happy to come back anyway.
Right. So, Mr. President, are you confident that we can handle all these cases?
Yes, because Hong Kong has experience before, and we have done something similar, although of a lot as big as scale at this time. But my caution would be if there is increasing more and more people that need to be quarantined. I really worried. I'm really worried about the capacity of Hong Kong, because Hong Kong is such a small place.
Right. So a final question, Ivan, maybe I would like to have your comment as well, is that actually the rapid test or the home kit that to detect any possible silent spreaders, would that be the possible resolution for the control of the silent spreaders?
Yeah, I think it's if you have a quick test that can give you a result in a few minutes, then it will be very good. But nevertheless, I think these kind of kits have to be tested clinically, making sure that they actually work and that they are very sensitive and that the other thing, of course, is probably it might be better, in fact, to use the kit in official clinics or doctors rather than as home kit, because if you're tested positive, I guess many of them don't really want to go to hospital. They probably will stay at home, and they keep silent about the whole thing.
Yeah.
So it's better, I think, to currently to run it in a either in a public clinic or in a hospital or by the A&E or in a private private doctor's clinic. That would probably be the best way to do it.
So are you guys validating, or is the technology available for the rapid test?
Well, I think it's available that there are certain kits that can process the assay in 30 minutes. But still, I think they can't do it as a home kit. They have to go to the facilities to do either providing an NPS or a saliva or whatever. Then they can do it. But it's still very quick. And I think the time-consuming part is probably the administrative part, whether you have to go there and then you have to process all the samples in a single batch. So you have to wait for everyone. So these kind of things slowing down the process rather than the test itself. The test itself could be very quick, but the administrative part will be much longer.
Yeah, I think, but we all agree that controlling the silent spreader may be the next big steps that of controlling the epidemics in Hong Kong. And is there other feedbacks before we close this session?
Well, I'd like to bring up one point, is that today is actually the day when Japanese government announced that the 14 days quarantine is going to come to an end today. So passengers on the Diamond Cruise who are tested negative are supposedly, if they do not change this policy, will be allowed home. So, and that would completely contradict what we are discussing here because the Hong Kong government, as well as the US government, as well as all other places, are having a mandatory quarantine of 14 days for these passengers. So
no, I don't agree with that.
Exactly. My concern, if Ivan or Albert here would
Andrew.
comment, my concern, like Dr. Hao, is that we will be, if Japanese government is allowing these negatively tested negative passengers to go home, we're extending time bombs in all places in the world.
And that's why you raised the control
Japan.
of the Japanese
Absolutely agree.
Do you agree the government to release passengers tested negative to go home?
Definitely
No,
not.
no. I think they should be quarantined for another 14 days at least.
Same as
It was
Otherwise, it's a complete
Problem is,
disaster.
it was not mentioned in any news report, even now.
All right. So
My advice is not to go to Japan now.
Exactly, I would endorse that too.
yeah. So any comments from President?
I think now Hong Kong is in a very critical moment that we are still, at a containment stage because most of the cases are just like close contact. So we have to enhance in the coming few weeks, enhance the surveillance. So I think the importance of so-called designated clinic would be important for enhanced surveillance in the community.
You mean the fever clinic?
Fever clinic, yeah, or designated clinic in different districts, so that they will be able to collect the data, and if the point of care test or rapid test is available, that will be even better, and that we know better what is the situation in the community.
Yeah, good. So I think we have to watch for the progress of these new epidemics. I think we just got its name, COVID-19, just more than 1 week ago. And still we have a lot of to learn from this virus, and definitely we need the great efforts from Ivan and the other colleagues to contribute to our human knowledge on this new finding. And I'm sure that I am confident in Hong Kong, and I'm so proud of all the team members in Hong Kong fighting against SARS, and now we are fighting against a new enemy which is called COVID-19. I'm sure that we shall overcome. Thank you.
Thank you.
Thank you very much. Thank you, Casey. Thank you. See you guys. Bye-bye.